Hello, and welcome to our deep dive on a truly fascinating and critical medical condition, one where the body's own defense system, in an attempt to save you, can actually become your worst enemy. Let's jump right in. You can think of your immune system as this highly trained, incredibly disciplined army, right? Its whole job is to protect your body at all costs. But what if, in the fog of war, in the middle of fighting a really bad infection, that army makes a terrible mistake? What happens when it sees your own lungs as the enemy and unleashes its full arsenal on friendly territory? Well, that catastrophic friendly fire is a very real and very devastating medical condition. And that medical friendly fire has a name: Acute Respiratory Distress Syndrome, or ARDS for short. Now, on the one hand, you have a healthy lung. It's supposed to be light, airy, like a sponge, perfectly designed to get oxygen into your blood. But a lung that's under attack from ARDS, well, it becomes a literal battlefield. It gets inflamed, flooded with fluid, and it's suddenly fighting a desperate, losing battle to do its most basic job. So, what are we really talking about with ARDS? It's important to know it's not one specific disease. It's more like a severe, catastrophic lung reaction that can be kicked off by all sorts of things, from infections to major injuries. It's basically the lung's panic button. The inflammation gets so intense that the tiny little air sacs, the alveoli, start to leak fluid. Essentially, the lungs start to drown from the inside out. To really get a sense of just how big a deal this is, let's take a look at how often this battle is actually playing out inside our hospitals. In the United States alone, we estimate that about 190,000 people are affected by ARDS every single year. It's one of the major reasons a patient might land in the intensive care unit. And its impact on our ICUs is just massive. ARDS is the reason for about 10% of all ICU admissions. And if you look at patients who need a mechanical ventilator to breathe, almost a quarter of them have ARDS. So the takeaway here is pretty clear. In the world of critical care medicine, ARDS is a huge and very formidable challenge. So what kind of event, what kind of insult to the body can provoke such a violent, self-destructive response? Well, let's line up the usual suspects. While there are actually more than 60 different known causes, it usually boils down to just a handful of major culprits. The number one trigger, by far, is sepsis. That's a life-threatening infection that spreads throughout the entire body. Coming in right behind that are things like severe pneumonia, aspiration, which is when you accidentally inhale something like stomach contents into your lungs, and of course, major physical trauma. These are the sparks that can light the firestorm. Now, because those early signs can be so vague, diagnosing ARDS is a lot like being a detective. Doctors have to piece together all these different clues and rule out a bunch of other possibilities to finally crack the case. In the beginning, the symptoms are sneaky: a little shortness of breath, maybe needing a bit more oxygen, things that are really easy to mistake for the original problem, like the pneumonia or the injury. And that's exactly why diagnosing ARDS is this puzzle, a process of elimination. And often, it's a puzzle that doesn't get fully solved until things have already gotten pretty serious. To solve this puzzle, doctors look for 4 key clues. First up is timing. The symptoms have to pop up fast, within a week of that initial trigger. Second, we look at the chest x-ray. We're looking for what's called a whiteout, where both lungs are filled with fluid. Third, we have to rule out other causes, mainly heart failure. Is the heart the reason the lungs are wet? If not, we move on. And finally, number 4, oxygenation. The patient's blood oxygen levels will be dangerously low, even when we're trying to help them breathe. Okay, so once ARDS is diagnosed, the clock is ticking. The focus immediately shifts from figuring out what's wrong to just pure support, and it becomes a fight for every single breath. This is probably the most crucial thing to understand. There is no cure for ARDS. There's no magic bullet we can give to make it go away. Instead, the treatment is 100% supportive. The whole goal is to keep the patient alive, keep their oxygen levels up, and prevent any more damage, all to buy the lungs enough time to start healing themselves while we treat the root cause. Now, the absolute cornerstone of this supportive care is a strategy called low tidal volume ventilation. And the best way to think about it is like this. If you sprained your ankle, you wouldn't go out and try to run a marathon on it, right? You'd rest it. It's the same idea with sick lungs. We don't want to use a ventilator to force huge, powerful breaths into them. That can cause even more injury. Instead, we use smaller, much gentler breaths to protect them. Another absolutely critical strategy is all about managing fluids. I mean, think about it. The lungs are already leaky and flooded. Pouring more fluid into the body is like trying to put out a fire with gasoline. So, studies have shown that what we call a conservative or dry lung strategy, where we aim to keep the patient's fluid balance neutral or even a little negative, that leads to more days off the ventilator and better outcomes. A few other key strategies are also in the playbook. One is called prone positioning, and it's surprisingly simple. We literally just turn the patient onto their stomach. It sounds basic, but it can dramatically improve how oxygen gets into the lungs. We also use something called PEEP, which is a gentle, constant pressure from the ventilator that helps keep those tiny air sacs from collapsing. And of course, all this happens while we are aggressively treating whatever started the fire in the first place. Winning that fight for breath in the ICU, that's a monumental victory. But the battle isn't always over when a patient leaves the hospital. Let's talk a little bit about what life looks like for survivors. First, we just have to be upfront about the hard truth. ARDS is a very deadly condition. The overall mortality rate still hovers at around 35%. It's a really sobering number that just highlights how incredibly severe this syndrome is. But, and this is a very important but, there is some good news here. Thanks to all these advances in supportive care, things like that gentle ventilation and careful fluid management, we are absolutely making progress. The survival rates have been steadily getting better over the decades. We're learning how to fight this thing more effectively. For those who do survive, though, the journey is often far from over. Many face a really long road to recovery, dealing with a condition we call post-intensive care syndrome, or PICS. This can mean long-term physical weakness, cognitive problems like brain fog or memory loss, and even psychological issues like anxiety or PTSD. Surviving ARDS is just the first step. So in the end, ARDS leaves us with this really profound and challenging question. It's a paradox, right? Our body's own defense system, trying to save us, can cause so much collateral damage. It really forces us to ask, how can we learn to fine-tune that incredibly powerful inflammatory response? How do we better train our body's own defenders to fight the enemy without completely destroying the battlefield? Answering that is the next frontier of research. Well, that's our look into ARDS. If you found this explainer helpful, we'd love it if you'd subscribe to What the Study Says and maybe share it with someone who might find it interesting. Thanks for joining us.